Hello everyone.
Hi, Shruti.
Hi, good morning.
Good morning.
We will wait for a bit. If I
Yes. Also, we are sorry that we are starting a few minutes late. We had a technical error, but now we are back on track. We have resolved the technical issues, and we will begin this webinar. And Shruti is going to start with the introduction.
Yeah. So, hello everyone. Good morning and thank you for joining us for our webinar today. Our webinar today is about CBT Toolkit for cancer patients, about which my fellow interns will be talking quite soon. Before we go ahead with our discussion for today, I would like to talk about Atha. Atha Center for Psychotherapy and Training is a Thane based specialized training and consultancy center that addresses mental health and well being since 2016. Atha Center has been built on two premises. First is psychological and evidence based psychotherapeutic methodologies, as well as Eastern psychological concepts. And the blend of both gives us our objective, that is to enable self empowerment and training for everybody that comes our way. Our vision here at Atha is to know, behold, and transcend. Know how powerful our mind can be, behold and observe its entire nature, and transcend our limitations from of our mind to live a more purposeful and more fulfilling life, and striving to build more emotionally healthy environment for all of us. Our motto here is to equip everyone with tools that they need for such kind of self empowerment and transformation. And I think all four of us here believe fully that psychotherapy is a very important tool that is not just for prevention but also for change and transformation in every single individual here. Further, I would like to talk about none other than Asira, ma'am. First of all, thank you, ma'am, so much for giving us this platform and opportunity to spread a very important message, to be honest. Asira, ma'am, as we all know her, she's the director of Atha Center for Psychotherapy and Training. She is a supervisor and an associate fellow of Rational Emotive and Cognitive Behavioral Therapy from Albert Ellis Institute, New York, and she's a level 2 training faculty. She has completed her master's in clinical psychology from SNDT University. She is also received her training in CBT from Beck Institute of Cognitive Behavioral Therapy, USA. She's also a certified Gottman leader. She is affiliated member of one of the most renowned organizations, that is American Psychological Association. She's also trained acceptance and commitment therapist, and also listed in the Association of Contextual Behavioral Science official website, as a ACT therapist. And oh my God, this is a huge list of accolades that she has, and as I think all of my fellow interns would agree, it was really amazing to work under her, and it was really nice that she could train all of us. So over to you, Asira, ma'am.
Yes. Thank you so much for your introduction, Shruti. I think it's very important to know what we stand for, what Atha therapy stands for, Atha psychotherapy stands for, what is our vision. Because we are going to take our vision forward today with this very, very insightful and a very reflective webinar. And I cannot be more proud of these interns. Actually, we have 6 interns, but three of us they really were very enthusiastic and they wanted to join. We are missing our other interns for sure. We will see them probably in some other sessions. But Shubhi, Shruti, and Tejas, they just jumped onto this opportunity. uh, to discuss their views with all of us. So let me introduce my lovely, enthusiastic interns. I'll start with Shubhi. So Shubhi, she is very much inclined to serve the community in the field of mental health and self-development. She's pursuing a master's in social work. Let's give her all the encouragement that she would need to serve and contribute to this field. She's also been working with reference to different educational and livelihood projects for the past 3 years. And she loves to explore topics which are around behavioral understanding, spirituality, and self development. So that explains the reason why she is today on this platform, and she's going to share her views with all of you. So Shubhi here. Then next we have Shruti. So Shruti is, she's done her master's, bachelor's from Mumbai University and is currently pursuing a master's in clinical psychology from Rajiv Gandhi University for Human Sciences, Bangalore. And her areas of interest lay in working with, the community, LGBTQ, the adolescent and the adult, she wants to work with adolescent and adult groups. And she's also very much interested to learn and understand and execute Eastern philosophical and psychological concepts. So we have Shruti here, who is very, very enthusiastic. Then who's the next? Tejas, our very own Tejas. So he is pursuing his first year bachelor's in psychology from Vivekanand College, and he wants to help people lead more healthy and meaningful lives. Interesting. He's also very much fond of logotherapy. So what is logotherapy? It's developed by Viktor Frankl. uh, and he believes that major driving force for individuals' life is, to have some meaning and purpose attached to different experiences, and that's why he's so much interested in logotherapy. So these are my beautiful, lovely, enthusiastic interns. And today, what all four of us are going to do is, because this is a very, very sensitive topic, it's one of the most difficult topics to understand, to interact with, and also to help, right? So we are really trying our best today to just share our understanding to how cognitive behavior therapy, which is a form of psychotherapy, which is a tool for change, prevention, and transformation, how this tool can help cancer patients. So I know this is a difficult feat and it's going to be a long road ahead. So this is just the start of our discussion. So I would request all the participants to understand this, webinar as a part of discussion. We're just going to introspect with all of you, right? And you can share your ideas, inputs throughout this webinar on the chat box. We will take your questions and we will also like to hear your insights. So let us begin with today's webinar, Cognitive Behavior Therapy Toolkit for Cancer Patients. Over to you, Shubhi.
Thank you, Asira ma'am. So before we understand the toolkits, let's first understand what cancer is and why we are talking about it today. So cancer is a disease in which our body cells grow uncontrollably and spreads over the part of the body. Now, February as a whole month we celebrate as Cancer Awareness Month, and in March we celebrate National Colorectal Cancer Awareness Month. So today, combining February and March, we thought we'll discuss about CBT as a tool for cancer patients. If we see globally, there are 8.2 million people in 2012, which increased to 9.6 million cancer patients in 2018. According to World Health Organization, if the cancer grows at this rate, then there will be around 6.3 million death by 6.3 million patients, cancer patients by 2040. But among this, 40% death, cancer patient death is preventable. If you want to look at the Indian perspective, around 13 million people suffer from cancer, and there are five most common cancer in India. One is breast, lung, mouth, uteri, and tongue.
I would love if Tejas can step in and talk more about Indian statistics and cancer.
Let's talk about the statistics of cancer in India. According to ICMR, the number of cases in 2020 of cancer cases were 1.39 lakhs, and it is estimated that in 2025 it would be till 1.59 lakhs. The total number of deaths in cancer in 2020 is estimated to be around 8 lakh 51,678, and these numbers are kind of nerve wracking to me. So what happens to the people who are affected by these um, cases, the cancer disease? When a person is when a doctor diagnoses a person with cancer during the first diagnosis, a lot of people feel a sense of shock because cancer is too overwhelming, and many people perceive this disease as as indestructible and there is no cure for it. So uh, they come in a sense of denial. They as a coping mechanism, um, they try to deal with the difficult emotions and situations by uh, just denying that they have cancer. And it is seen that from 4 to 47% of cancer patients deny their first diagnosis. Uh, and so these patients go through 5 stages of acceptance, that is denial, anger, uh, bargaining, depression, and acceptance at last. And the problem doesn't end here. During the treatment, there are many um, changes, like there is physical changes, there is change in the roles they play, like in the society and uh, in the household. Like a person who is very social uh, feels that due to the cancer, they feel a bit isolated, and parents who help their children need help from their children due to cancer. So there is a decrease in their self worth, and many patients uh, also suffer from depression and anxiety during cancer. It is seen that from 8 to 21% of cancer patients suffer from depression, and it is said through research that 30 to 35% of patients suffer from some psychiatric or neuropsychiatric disorders. And to deal with such changes and uh, gain some mental clarity, Shruti will talk about CBT, that is cognitive behavioral therapy, and how to cope with these situations.
Thank you, Tejas and Shubhi. As we all can see, how cancer has affected so many people in India, all around the world, uh, we come to this conclusion that dealing with cancer itself and even the diagnosis cancer itself is a big deal for a lot of people, and a lot of other side effects of going through the treatment in and itself is really very difficult. And it's in such circumstances CBT can be a very useful tool uh, for people who are going through all this in their life. uh, a lot of people ask us this question is what is CBT exactly? CBT, as we all know, the full form stands for cognitive behavioral therapy. It's a form of psychotherapeutic treatment that can help an individual identify and change their negative automatic thought. CBT In CBT, we tend to focus on our thoughts, behaviors, and feelings because they all are quite interrelated with each other. If we, take a deep look into all these three aspects, uh, as I mentioned, negative automatic thought, as the word stands, as it suggests, it's a very negative automatically generated, it is very random, spontaneous, negative thought which is directed towards ourselves, probably our situation, you know. We It's not just for people who have suffered from cancer, but also in our general life. You would have observed if there is something, difficult going on, the first thing that comes into our mind is like a very negative thought towards ourselves. So CBT here can help an individual identify these thoughts, uh, teach them and equip them with skills to deal with such thoughts, and help them manage uh, the issues that they are having, uh, which also influences their behavior. You know how most of the time if we are having such negative thoughts, हम बहुत ज़्यादा चिड़चिड़ हो जाते हैं, like we are very irritable, or we are very sad. We don't engage in the activities that we really like. So that we'll be talking about further, but this is how CBT can help individuals to set their goals, and go through the phases of acceptance that they just mentioned before. So here is about what CBT is and how CBT can exactly help. And Shubhi is going to further help us understand about CBT more. Over to you, Shubhi.
Thank you. So, CBT, as you understood, was cognitive behavior therapy. Now, during cancer time, when from the moment it's diagnosis to the whole therapy, there are various stages we go through, right? Chemotherapy, radiation, surgery, medication, and the process, the duration. We tend to feel a lot of depression, anxiety, panic attacks, and much more. In short, we have divided into two. One is helplessness, and second is hopelessness. We categorize all the pain and negative um, behavior or thoughts, emotion under these two categories. Now there were various examinations and research was conducted around how CBT tool will help cancer patients, and you will be surprised to know that it really helps you once you have a control over your mental health and you understand the process in a positive outlook. It helps you boost your immunity, and once your immunity is boosted, it gives you an overall development, emotional development, physical development, and you tend to look even the cancer period in a very positive outlook. You have a hope for life and people around you. CBT tool will also help you manage your negative emotions. It will understand tricks and tips that can help you understand the process of cancer treatment and accepting things the way you are, which will, I believe, when I was reading and going through all the documents, which I believe help you a lot to have a self acknowledgement and appreciation for the pain and courage you're showing to go through the cancer treatment. Yes, I would love if Asira ma'am can step in and share her thoughts.
Thank you, all three of you. I think they have, made it very clear to us about what is cancer. Then we understood the current, status of cancer in India. How is it globally? Shubhi also started with giving us, understanding of the global outlook. What is the global status of cancer today? Then they just talked about cancer and mental health in India today, how it's related, what kind of psychological distress patients who are diagnosed with cancer go through. And then Shruti and Shubhi again talked about CBT and why CBT is such an important tool for patients who are suffering from cancer. How is it going to help them? Right now, our main focus is going to be the toolkit, because remember, the topic of the webinar is CBT toolkit for cancer patients. So what we all four have done, we have tried to think about some tools that we could talk about, and we could start start using them when we are working with cancer patients. I want to tell you again and again that this coping toolkit that we are going to talk about is basically a preventive toolkit. So it focuses on a lot of prevention. It also focuses on readjustment, how to readjust to this diagnosis. Because yes, the diagnosis is difficult, no doubt about it. And it is very simplistic if I just say that it's difficult. I know people who actually go through it, individuals, patients who go through cancer. It is a difficult journey, more than difficult. So we acknowledge your struggle, we acknowledge your emotional turmoil while you're going through the diagnosis. But there are coping tools. We can readjust to this diagnosis in an healthy manner. So that's what we are going to discuss today with reference to this toolkit. Right? Now, you remember, and I'm sure many of our participants know that whenever we have any webinar, we try to design an acronym. So all of us have designed a specific acronym for this CBT toolkit, which we call Still I Rise. So this is your toolkit, Still I Rise. Now, why did we choose this Still I Rise? One thing came to my mind with reference to understanding cancer patients. How do they see themselves? How do they see the diagnosis? How do they see the prognosis, the recovery? So I would like to share, something that I wrote and why this acronym is so important. Still I Rise. Individuals who are going through cancer diagnosis, they have a lot of doubts, right? They have a lot of fears, insecurities, uncertainties. So here is my presentation. With dark clouds of fear and doubt, with thoughts about pain, with questions about life and death haunting my mind, but still, like the rays of hope, I rise. And that's what we are going to do today. Still, I rise. So, even when we are walking through this difficult journey, we can look forward. We can be hopeful. We can help ourselves adjust to the diagnosis in an healthy manner. With all the vulnerabilities, we will embrace the vulnerabilities. How to do all that? That's what we are going to share with all of you. 10 tools to readjust to the diagnosis of cancer. So let us begin. Still I rise. Shubhi is going to start with the first tool.
Yes.
S.
S, slow down and be mindful. So, mindful is a process by which we just observe our thoughts or emotions or feelings that's going through without judging, without concluding, without criticizing. We just observe. I know it's very difficult because normally also when we do it's so difficult to we try to do the question and answer round when we are just looking at our thoughts. But a little trick that will help you here is why don't you write it down somewhere? You write it, you make a journal, or just sit with nature. Use your five senses and calm yourself first. Look at the sky, look at the trees, listen to the sound of birds or any movement in the nature. Go for a morning walk. Feel the warmth or wind of the morning blues. And once you do that, let's like one journal idea I can give is that you make three sections. One, write date. Second, your thoughts or emotions. And third section, mein, you can write on a scale of 1 to 10 how much you feel about it or how much you are inclined towards it. Let's say I'm feeling very low today. Today is 6th of March. And on a scale of 1 to 10, how low do I feel? Maybe 5. So once you make a journal out of what you feel or what you think or how your emotions are feeling or changing day on to day, you will have a better awareness. You will be more mindful towards your body. And slowly, slowly, of course, you will start observing rather than judging. One very one very great quote which is very close to my heart in terms of mindfulness is mindfulness is a way of befriending ourselves and our experience. Our experience, our journey doesn't define us. We just have to accept that it is making us much more stronger. We need to be more mindful about our thoughts, about our emotions, and about how we feel and what we feel. Let's
That is
move to our
such a
next.
Yeah, Shruti,
Sorry.
that was such a beautiful, tool in terms of mindfulness. And I would like to ask all our participants, don't you agree with what she said with reference to go slow and be mindful? Psychologically, we say when we are mindful about our emotions, we are, as she rightly pointed out, emotional awareness is there, right? And we are also in a better capacity to stand behind these emotions and not get carried away by them. And Shruti and Tejas, what do you think about mindfulness and slowing down?
Ma'am, I would totally agree to you and Shubhi. A lot of the times, what I've seen with a lot of cancer patients is they have so many thoughts rushing in their mind. It's not just about their health, but also they worry about their family a lot, you know. So, a lot of the times, what happens is it is very important to pause sometime, you know, calm yourself to help to calm yourself down, you know. And this toolkit that Shubhi was talking about is really very helpful for reminding these people that it is important to, you know, halt a bit, take a breather and go ahead and try to understand your body and your mind and how they both are, related to each other.
Very true. Tejas, you have something to add?
Yeah, mindfulness is not just for cancer patients, it's also for everyday people. Like people who have stressful jobs and think that mindfulness is a waste of time, they need it more. Like just give it 10 minutes and you will feel a lot of your stress goes away. And people with anxiety also can can have benefit from mindfulness because they become aware of their thoughts. Uh, kind of
Right.
they try to run away from their thoughts. So staying still and recognizing what are these thoughts, and um, in a mindfulness practice that I have heard, you just think these thoughts are like clouds and your mind is a sky. So uh, all thoughts are not so important, and um,
Right.
your yeah, your entire yeah, just thoughts are
All
not so important. And
no, yeah, such an insightful line there. All thoughts are not important. So what Shubhi and Tejas and Shruti and we are trying to say is observe without judgment. That is mindfulness. Vulnerability we need to embrace, observe it without judging it. Like how she said, we can go into nature, we can walk, we can have mindful nature walks, just appreciating nature, just observing it without judging it. And we have insights coming from our viewers. Dhaval, very proud of you. She's a cancer survivor and clinical psychologist. Excellent. And thank you for joining. You could share your insights with all of us. Then Shrikant sir is also saying pause and mindfulness will decrease anxiety, producing hormones, and there will be more acceptance. Yes, it's an acceptance based tool. And someone also asked us, can we try Tai Chi or yoga kind of tools for slowing down? Definitely. Yoga really helps, breathing exercises, right? These are mindful exercises. So this is the first tool. Slow down, be mindful. Let's go to the next one.
So, I'll be talking about the next tool, that is turning towards your support group. A lot of the times, what happens with cancer patients is that they feel that they're burdening someone else, like, मैं इससे बात नहीं कर सकती because I'm already enough dependent on my family. They feel a lot of guilt for depending on their caregivers, their friends, their family because they are going through an illness. This might, make them feel very low, very isolated from their family members because they can't share things in their life. A lot of the times we need to remind them that it is very important for them to utilize these support systems that they have, and build more support systems for themselves. Uh, a very good example could be support groups. There are certain support groups that could help individuals to vent out their emotions, to make them understand what they are going through. And staying in touch with these support groups is really very helpful. That is because you have people who are going through the similar life circumstances as you, and that in itself can be very, very empowering for someone. So, here, what I really want to highlight is that it is okay that you ask for help, and it is sometimes very important that you ask for help, you know. So, yeah, that's it. And I think I'll forward the mic towards Tejas for going further.
Right. And
Mhm.
before we start with the next tool, also all our participants, you can let us know whether you agree with this, turning towards support group. As Shruti importantly mentioned that sometimes they feel like they are burdening the other person. So they might feel as if they are a burden, they might feel very guilty. But it's very important that we normalize seeking help, seeking support. So in the chat, we are sharing two websites where you could read cancer stories and where you could understand that there are so many people who are going through these difficult journeys and they are seeking help and they are relying on the support system.
The next tool what I'm talking about is
Tejas, sorry to
indulging.
interrupt.
Sorry,
Just your mic,
sorry.
can you just hold it a bit closer?
Am I audible? Yeah.
Yeah.
Hello. Yeah. The next tool I'm talking about is indulging in pleasurable and mindful activities. When a cancer patient is diagnosed with cancer, their life changes drastically. There is a lot of numbness, uh, the feeling of uh, mm, that my life is over, and a sense of doom. And people concentrate a lot in the disease and treatment, and the the procedure of the treatment, and they forget to indulge in activities that made them full of joy and made them happy. So uh, people around the patient should encourage the patient to uh, indulge in these activities uh, to further overall mental well-being, like going for evening walks, um, listening to music, mm, coloring, painting, etc., can elevate some stress and uh, help in um, improving their mood. And sometimes cancer patients also feel a low self-worth because of their roles in their society, and um, household has changed. So, and there are a lot more changes like physical changes. So um, they can indulge in some activities like um, grocery shopping, doing bank work, cleaning, which can increase their sense of accomplishment, and they will feel productive, and it can increase their confidence and self-worth.
Right.
Yeah.
That's very significant point. You know what Tejas is mentioning. Don't you think that cancer patients, because they're going through such a difficult phase of treatment protocols, medication, sometimes it's very difficult to slip into a mode where thoughts like I am anyway useless, I cannot do anything. I read one story of a cancer patient. She got diagnosed with ovarian cancer, and suddenly what happened, her schedule really changed drastically. She was very much into working, continuously, like for 8 hours, 9 hours, and suddenly now she can only work for like 2 hours. Sometimes she doesn't even feel like working for 2 hours. A lot of tiredness comes. And what happened? She slipped into that zone where even when she could have done little tasks like probably coloring, talking to someone, she did not indulge in these activities, and she felt more depressed. She felt more helpless. She felt more worthless. So, what Tejas is basically trying to tell us is we need to engage, we need to indulge in pleasurable and mastery activities. At least one pleasurable or one mastery activity daily. And as caregivers or as family friends, we can offer support in terms of these activities. You could take your friend who is going through cancer probably for a short walk. You could listen to music together. These activities really help to build self efficacy. What do you think, Shruti and Shubhi? Does this point ring true to you?
I would totally agree to this, is because a lot of the times patients, they feel bad. Like, abhi to I can't do anything, and as you also highlighted, they feel that they are useless. There's no hope in life. So what's the point in doing all this? But they need to be reminded that you are doing this for yourself, and all these activities are very important for you and for your mental health. So maybe, a nudge, a small nudge from their friends, their family members can, make a lot of difference for these patients. What do you
Right?
think, Shruti?
So, and also when we were discussing on it, I just remember even achieving small tasks like reading 2 pages a day, or waking up on time, or just sitting in the sun, it can also be an achievement, right? We have to start acknowledging small little actions and treat it as like an appreciation to yourself, because not everyone is doing it. So if you're doing it, kudos to you. So yeah,
Right?
don't big task. Don't say the, oh, I felt pain, then only I'm achieving something. Even picking up or searching about paint colors and different kind of brushes is also an achievement. And sure, we can set this small targets also. Even researching is a target. So yeah.
Right. And as she's mentioning, I think this is a very good point that do not look only for significant tasks. No, as she said, even searching online, even trying to get up, even trying to walk 1 minute, that also needs to be credited and encouraged. Right? Someone is asking us how to find what activity may be pleasurable. See, you could, we can come up with list of pleasurable, comforting activities, soothing activities, right? Like as she said, coloring could be one, just sitting in nature could be one, listening to one song could be one, playing cards could be one. And let me tell you, cancer patients might feel that I don't want to do it. This thought is common. We have to keep that thought in the back seat, and we have to do these tasks with them. So the responsibility lies a lot on the caregivers to start making these efforts. And we know caregivers also go through a lot of anxiety, depression, and emotional stress. But that's where this toolkit is going to help all of you, right? And examples of mastery activities could be, anyone wants to share any examples for pleasurable and mastery activities?
uh, sure, I just want to share one my thought. um so this is of course a question that what should we do, right? So there could be two ways. One is you reflect on from since childhood what you loved doing. You loved playing cards, you loved drawings, you loved listening to the music, different kind of music. So you loved reading about literature. So one way is you reflect on your childhood and your past, and then pick it up those activities again. Again, like I focus a lot that don't set big targets for you, set very small targets so that it feels you achievable and you feel rewarded. Second is what I personally do is you go to Instagram, check, and anything that fantasize you, you should try it at home by yourself. So even if it
Right.
doesn't seems to be perfect, even if it doesn't seems to be Instagram perfect, but I do this a lot. Anything that fantasize me, I just try it from my hands or something like that. I'll
Right.
just try it on my own. So yeah,
Right.
these are the two ways where personally I find things to do in life.
Right. That's good. And Megha is also giving us a very nice activity. Spend time with your grandchildren. Yeah, just sitting with them. Right. This is very, very important. And I think at each and every hospital also we could have these kind of interventions. So at the level of hospital also we could start using these tools between the breaks from chemotherapy when they are back to the room, what they could do, or they can just sit, you can do something. I remember my own personal experience when my mother was fighting through cancer. And when we used to go and help her, be with her, we used to make art and craft material. We used to do something and show her. That itself used to give her that soothing, they're doing something. And it's there on the wall. So we used to show her pictures, albums, past albums, photographs. She was feeling, she used to feel very tired to even hold the phone. We used to hold the phone and have these activities. This itself can be so helpful to the patient, right? So who's going to go to the next point?
Uh, I will be the one going next.
So
Someone
Shruti,
here in the
before you go to the next point, just summarize all the points from the start of the acronym.
so yeah. So we start from the word still. S stands for slow down and be mindful. T stands for turning towards your support group. I stands for indulging in pleasurable and mastery activities. And now coming to L, learning to focus on other aspects that aren't affected by cancer. A lot of the times with cancer patients, what happens is that the magnitude of being affected or being diagnosed with cancer consumes their life a lot, and on top of it the regular treatment, the regular appointments that they have to go like every other day to doctors, various tests and treatments that they go through, a lot of the time they lose focus about the aspects of their life that are not affected by cancer. So a lot of the times they have to be reminded कि देखो यार, there are certain things in your life that aren't affected by cancer. Like for example, a very personal example, I had a friend who unfortunately had been diagnosed with cancer a couple of years ago. For her, her morning routine was something that she really loved. She used to wake up at certain amount of time, and coffee was something she was obsessed with. Like she had like a proper barista style espresso machine in her house that she really loved and she looked forward to it. And she used to say कि यार ये एक चीज है ना मेरे life में which is not affected by cancer, and I think coffee doesn't harm anybody. So this is what she used to like a lot. And a lot of the people would say is यार ये सब करके क्या फायदा होगा, you know. But as Shubhi has mentioned, small steps, baby steps matter a lot. It seems quite insignificant, but it does. Focusing on what you want to do in your future life, that is something also that could help. People say कि अभी future का सोच के क्या फायदा? I only have 6 months to live, or a very small amount of time to live. तो future का सोच के क्या होगा? बट दे नीड टू बी रिमाइंडेड कि फ्यूचर जितना अनसर्टन है, तुम्हारा प्रेजेंट भी उतना ही ज्यादा अनसर्टन है. सो व्हाई डोंट put efforts to goals that you always wanted to achieve but could not due to some reason, you know so that is what I'm trying to focus here, is to learn to focus on things that also make you happy, that you haven't done in quite some time, and that aren't affected by cancer, that could make you feel that you're going back to normalcy again. So here is my point. What would all of y'all think? You can
Very
mention in
well.
the chat box itself
Right.
what the audience is thinking.
So this is a very important point. You're mentioning that learn to focus on other aspects of life that aren't affected by cancer. And all these tools, we are just starting the conversation today. We want all of you to go back, think about these tools, Prepare your own interventions based on these tools. We are sure you'll have a resource with you, right? So we will continue. Let's go to the next one.
So as we talk so much about mindfulness, little activities that we do, right, and seek for help, during all this time we then go through a lot of emotions, a lot of triggers that happens in our life, right? A lot of incidents or words that can just just aggravate our anger or our sadness or a sense of helplessness. And during, like, not during, like, generally also in life, we should know how and what our triggers are. We have to understand what triggers, what can trigger our emotion and slow down our mood or our body system or our thinking capacities. So though in CBT we have a detailed tool of trigger thoughts,
Reaction.
any reactions, yes sir, thank you. But today I'll just talk about triggers and how we can understand our triggers and bring awareness towards our triggers. You can write it down, of course. We promote a lot of writing, so you can write it down somewhere. You can reflect on your triggers. I preferably, once I actually started, personally also started writing my triggers, it helped me a lot. I used to write date, trigger, and how much it triggered me. Some triggers are very small, but because we have not processed it, it stays with us. Let's say we have a fight with our family. It's very natural that we don't always agree with each other. Now, that fight, we also know it's gonna last 1 hour or at least 2 hours, not more than that. But it's very important that we have an awareness towards that trigger, so that if the same thing happen next time, we at least know that this is not that much we should be tensed about, or it's not a big deal. It's okay if my sister is not giving me a glass of water. It's okay, it's not a very big trigger, or I should not feel sad or hopelessness after that. So writing your triggers will help you so much, even understanding your emotion and acknowledging that. So as we are talking so much about doing activities, seeking help, being mindful, it's also very important that you understand what makes you feel. What are you feeling? What makes you feel sad, angry, happy, cheerful, and how it's related to people, how it's being connected to your environment and surroundings. So yes, if my team members or the audience wants to put in, I would love to know your thoughts.
Can our audience tell us what kind of common triggers cancer patients might experience? And all three of you also, any reflections on that?
Uh, Probably as simple as uh, not being able to do the activities that you were able to do. That could be a very important, like very difficult thing to deal with.
Right?
Uh, Maybe you were able to keep up with certain activities. Like for example, one of like my friend whom I mentioned before, he used to like to play cricket with his friends, like every Saturday in his society, in his building. And when he got diagnosed with cancer, he couldn't do that. Like at least for the initial part of his treatment, he could not. So that was
Right.
something, and also being cooped up in the house, only working his office work, and there's not being any let out for what he's feeling. That in
Right.
itself can be such a big trigger.
Right.
You know.
Anyone else?
Um, an
Someone
example I
here,
mean.
sorry, someone here in the comment section mentioned
Mm-hmm.
people coming to meet and talk about how painful that can be and what they are going through,
That
rather
is
than being
very,
positive.
yes, that could be very distressing.
Yes.
Shrikant sir is also mentioning about hospital environment and isolation. Yes, this is very common. Reading the news of death of people from cancer, change in body parts, watching photos of post chemotherapy effects. Right. So many examples. and they are all very, very distressing, right? And these triggers would help the client, help the patient to address them. So Shubhi has given us a very thoughtful point. Understand your trigger. So lift your awareness by understanding what triggers you. Now, next is my point. So quickly, for individuals who have just joined right now, our toolkit is Still I Rise. The S stands for slow down, be mindful. T, turn towards your support group. I, indulge in pleasurable and mastery activities. L, learn to focus on other aspects of life which aren't affected by cancer. L, lift your awareness by understanding what triggers you. And next, I, our interpretations and perceptions largely influence our feelings and behaviors. I'm sharing with you the heart of CBT. This is what is the heart of cognitive behavior therapy. CBT says that yes, cancer diagnosis is a life changing phenomenon. It is difficult, discomforting, unpleasant, unfortunate, very, very negative event. But what disturbs us are not these events. They definitely activate our disturbances. But what disturbs us are the interpretations that we attach to these events. What are we interpreting when it comes to cancer diagnosis? What am I telling myself about the diagnosis of cancer? I remember a case study where, the cancer patient was going through, at the trigger level, was going through a lot of tiredness. After each chemotherapy, lot of tiredness, which was anyway activating lot of hopelessness. Yes, it was. But you know what maintained the hopelessness with the tiredness? The meaning, the interpretation that the patient attached to the tiredness, which was, I won't be able to cope with the tiredness. I don't think I can do it anymore. It is unbearable. I will never come out of this tiredness. Now, these thoughts, these interpretations, which we call negative interpretations, these do not help us adjust to the cancer diagnosis, unfortunately, because they are negative, right? And when we interpret the cancer diagnosis, the personal meaning, if we are attaching in such a negative manner, what happens? We are not able to psychologically manage our emotions. Our quality of life goes down, right? Rather than focusing on what can be done, we focus on cause finding. So these negative interpretations disturb us, and not just the cancer diagnosis. And I know it is very simple for me to put it forward. Individuals who go through it, hats off to them. We can never even imagine what kind of emotional distress they have to go through. I'm just saying, if we have to readjust to the cancer diagnosis, we have to take a look at our interpretations. We need to check these interpretations. So, I'm going to share a very important skill now, how to check these negative interpretations, how to evaluate these negative interpretations. I call this management of negative self talk. I heard a very beautiful quote that what happens to your life, I think it is by Gurudev of Chinmaya Mission. He says that what happens to your life is not probably in your control, but how you meet with what happens in your life is something that you can look at. So destiny is what happens in life. But you know what is free will? Free will is what we do with what happens. So how am I approaching cancer diagnosis? Let's talk about it. Let's try to understand this. So, what is the tool for managing these negative interpretations? So, the tool is scan. Scan these negative thoughts. Anytime any negative thought comes to your mind, like I cannot cope with my tiredness, scan it. How will you scan it? So, the scan itself is an acronym, which is the password for difficult negative thought management. The S stands for, see if your thought is an assumption or is it a fact. Now, when this client said that I can't cope with tiredness, actually this was just an assumption because after 1 week, the progress was there. She was able to manage the tiredness. But if she wouldn't have scanned this thought, what would have happened? More distress. So S stands for see if your thought is an assumption or is it a fact. Second, the C stands for count your daily progress, setbacks. Generally, what happens with cancer patients or with individuals who are going through difficult illness, they will keep count of setbacks. Oh, this is not working, this is low, this is too high. So this is a very important mechanism. Count the daily progress also and setback also. Even if the progress is 0.00001%, count it, because that will give you an eye to look at how to go ahead. So S stands for see if your thought is an assumption or a fact. C stands for count your daily progress and setbacks. When you count your daily progress, you feel motivated, and when you count your setbacks, look at it, how what can I do to problem solve? Rather than saying, oh, this setback is here, look at it from a problem solving point of view. What can I do about it? And let me tell you, this tool even caregivers can apply because they also go through negative thoughts. So caregivers should also ask this. Okay, these are the setbacks. What can we do to problem solve? So SC. Then A. A is alternative possibilities. I remember another case study of a cancer patient going through breast cancer recovery. Okay, and actually the recovery was good, but suddenly in some scan assessment, some abnormality was there. Now she told herself in her mind that this abnormality means my cancer is again back with, like, it's the most severe again, like how it was at the start. But what if she would have taken that abnormality in the chart from alternative perspectives? Or maybe the cancer is back, but it may not be that severe. It could be preventable. Maybe one more chemotherapy could help. And actually, when she went to the doctor and saw, it was a minor, relapse, which could have been handled, which was handled carefully. Intervention was needed, but it was not severe. So alternative possibilities, now you have to think, oh, what is an alternative way of looking at this? What could be another explanation? Rely on doctors' information. Do not rely on Google, family, friends. I know they really care for us, family, friends. I don't know about Google, but family, friends definitely care a lot. But they are not the authority. So rely on the reliable source, which is the doctor. So what am I trying to tell you? Our negative interpretations, they are going to stop us from adjusting to the cancer diagnosis. How to examine these negative interpretations? Scan tool. Scan these thoughts. Check them. C stands for see if your thought is an assumption or a fact. Count your daily progress and setbacks. When you see setbacks, look at how to problem solve. A, look at it through alternative possibilities. Ask yourself, what is an alternative explanation of it? Rely on doctor's information only. And the last N, need to weigh advantages and disadvantages of your negative thought. Now tell me something. If I have this thought, I can never cope with tiredness. Will this thought help me cope with tiredness? Or will this other thought help me that yes, tiredness is very painful, it's very, very inconvenient, but I'll take one step at a time. Will this thought help me to cope with tiredness? That's why this need to weigh advantages and disadvantages is very, very important. Mostly our negative interpretations are disadvantageous. They don't help us face the reality and equip ourselves with the reality. They take us away from the reality and we get into cause finding, blame giving, and a very passive kind of overthinking. So this is my very, very important tool for all of you, that after you understand your triggers, the next thing that you will do is, I hope you remember what will you do the next. Interpretations largely influence our feelings and behaviors. So scan your negative interpretations. And let me know in the comment section, do you agree with this tool? of scanning your negative interpretations and then, going ahead. Any thoughts by the three of you?
I would not agree more than what you have just said. A lot of the times we focus on our bodily functions, what is going on in my body, but we also need to focus on what's going on in our mind. You know, the scan word itself stands for, scan your thoughts. As you said, the interpretations of having cancer itself can affect the way we behave, the way we feel. I think it's
Right.
very important for us to, go through our mind, see if it's just on my assumption or is it fact. Listen to your doctor always. Uh, your family obviously means good for you, but sometimes they can be wrong as well
Right.
for certain things. So listen to your doctor always. And as you say, pros and cons of having such kind of thought. Is it benefiting you? For keeping such kind of thoughts and this kind of, what do you say, perception about having cancer, how this is negatively affecting you, that can be very helpful for someone going through.
Right. And I remember one of the cancer patients made this was her, what you say, motivational statement that the cancer can affect my body, but I'm not going to let this cancer affect my mind. Such a powerful statement that can only happen if you scan these negative thoughts. So let's go forward, Tejas. What do you have in mind?
Are we talking about the next tool or this?
Tejas, we can't hear you very clearly. Okay, just the
Hello? Hello?
Yes,
Yeah,
Tejas.
we are talking about the next tool or my opinions on.
next tool. We can go forward.
Okay, okay. The next tool is recognizing catastrophic thoughts. As cancer is a very overwhelming and stressful disease, uh, many people think that their life is over, their future plans are shattered, and their it sounds like a doom, and everything sounds very bleak. So we should challenge these catastrophic thoughts by recognizing the fact that all types of cancers are not the same, and different cancers have different mortality rate. And like ma'am said, that we should always listen to the advice of doctors rather than Google, because when we check our symptoms, it uh, uh, always it does not uh, lead to a good result. So, and there was a case where uh, a woman was diagnosed with cancer. She um, left the treatment and uh, was full of anxiety and worry. When her parents and friends encouraged her to go through the treatment, she thought she found out that she had thyroid cancer, and it could have been improved by just a small surgery which had 99% survival rate. So she got better and said that in her blog that all that worry was of no use, because it could have been solved much faster. Yeah.
Right. So this catastrophic thinking is what he's saying, that we have to identify and we have to even examine it. Right? Have you ever had such experience that you thought something in a very very negative way and actually it didn't happen
To be
and you
honest,
were
it
able to
happens all
manage?
the time.
Right. And should be, what about you? Yeah.
Yeah, so I think the word cancer itself now, even we have so many pre-assumptions about it. But as we read, even WHO said that 40% are preventable and curable. And it's very, very important for us to surely consult a doctor at right time, and we should actually go through a body diagnosis. And that way, like one of the breast cancer awareness is that every woman should go at least once for a regular checkup. So it will not even help in highlighting if something is coming up in your body, but it will also give you a very healthy outlook. So it's very important for us to not pre-assume and actually go with reality. So I feel
Right,
the whole points are so interconnected to each other. And yeah,
right, right.
even
Yeah,
the caregivers should understand that we should not pre-assume that we are caring less or we are caring more, or this is not the right way, that is not the right way. Rather, we should discuss with our doctors and discuss with our support group, and that's how we should try and explore. Yeah.
right. Somewhere I heard, cancer is equal to death sentence. This is catastrophizing. That it's not always the end of the world. And even if it is the end of the world, what can I do to cope with that? How can I try to help myself to accept the reality? I know it's again very difficult to say. Probably with advanced stages of cancer, this could be catastrophic thoughts are many. So you could help them with other tools. But with other types of cancers, which are probably in the mild, moderate range, we need to address this catastrophizing thought that you are assuming that it's going to be the end of the world. But what's the likelihood? That likelihood only doctor can tell you. So listen to the doctor again, see that likelihood. Is it likely in your case that it is going to be the end of the world, it is going to be the most horrible outcome? No. So then let's get back to the realistic outcome. Reality is, yes, there will be pain, tiredness, but there will also be recovery. And even in advanced stages cancer, there are so many advanced medical treatments available now. So we can definitely, as caregivers, we can facilitate good quality of life. We can contribute towards their good quality of life. And that will only happen if we leave these catastrophic thoughts behind and think more realistically.
You know what comes in my mind is the word scan, as you mentioned before. You know, scanning these catastrophic thoughts that you're having. A lot, as you know, our participants and people watching would have seen, all these uh, tools are quite interrelated to each other. You know, so y'all can go through your own thoughts again with the help of these acronyms. It is very interconnected. It will for sure help not just cancer patients, their caregivers as well, and also people who have been going through a difficult time in their life right now. So, yeah.
Right. So now we come to some last tools. So after he shared with us about recognize catastrophic thoughts, sorry, and examining it. The next three. So the next I is increase resilience through self-coping statements. So after you have scanned these negative thoughts and these catastrophic thoughts, what you have to do next is rely on your self coping statements. These self coping statements are nothing but mantras. Mantras that are going to boost you, that are going to motivate you, that are going to act as your own self inspiring thoughts. See, when you are going through cancer treatment, many a times your loved ones are not around you. You are there and that machine is there. But who is there with you during that time? With you is your mind. So, what thoughts are you going to nurture in the mind during that process? For those difficult journeys, we need reasonably hopeful, uplifting, self-coping statements. And what will happen when we keep using these self-coping statements? What do you think? Anyone?
Your brain automatically starts saying that in the difficult situation. So slowly it's difficult. Slowly you might have to remind yourself. But after a time, you'll see any difficult situation that comes in, your brain started talking to you in those positive statements and narrations only,
Right.
and it uplifts you. Yeah.
So it uplifts your mood. That's good. Anything else? What these self coping statements will do for a cancer patient? Think.
To be honest, it will make a lot of difference for them. You know, it
Right.
will make them feel better. A lot of the times when they are going through that uh, a
Right.
circumstance where you are in that room going through that treatment, the thought of your mere presence in that room can be so anxiety provoking, you know. So, constantly reminding yourself with these positive thoughts can, help you a lot.
It will help you a lot. Someone is saying it will generate hope and optimism. Excellent. Yes, it will generate hope, optimism. It will improve your mental health. Tejas, you have something?
Yeah, just the same. We get comfortable with the negative thoughts and the pain. I don't know to say, but yeah.
We'll get
uh,
comfortable with the negative thoughts. Okay.
hmm.
If I tell you exactly the science of coping statements, these coping statements help you to adjust to the reality and be flexible. It keeps your body's focus on prevention, on recovery, rather than on the distress. So it serves as a distraction also. Yeah, Shrikant sir was talking about good diversion from negative thoughts. Yes. One is it serves as a distraction, and second, it helps you to cope with the reality in a healthy way, in a healthy, disturbed way. So it's not that you're going to feel positive, not like that, but you will face it. You will have resilience. That's why this point is increase resilience through self coping statements. Now you go through, you go back to your own life and remember, imagine if you have ever had a difficult experience, don't you say something to yourself to go through that experience? People use God's name. That is also one self coping statement. Or we might say something. I remember one of my patients who was suffering from anxiety. She used to chant the Hanuman Chalisa, right? Now, it could be anything. So, self coping statement is any statement that boosts you, that helps you be resilient, bounce back, and cope with the adversity. So, do you have any such coping statements? And I would like our participants also to share if they have any such self coping statements. I'm going to share a few which cancer patients have created. So some of the cancer patients, their coping statements, we could actually make a list of these, and this would help so many cancer patients. One is cancer is affecting my body, but I'm not going to let it affect my mind. This I shared with you. Then one day at a time, that will be my focus. Yes, I'm feeling angry about getting diagnosed with cancer, but I'm going to express myself and I won't think of it as an end. I won't think of cancer as an end. Yes, it is difficult to bear this pain, but I'm coping through it each minute. I will look at what is working right now rather than worrying about what will happen next. I'm doing my best. Doctors are doing their best. I cannot change the wind. I will keep adjusting the sails. So powerful. And this is my favorite. Courage is not about never crying. Courage is about crying and trying. That's what courage is. So, we could use these coping statements, and as a community, we could actually create a list of these self coping statements for cancer patients. Anyone wants to share any thoughts on this?
In the comment box, Shrikant sir just mentioned that I have overcome many difficulties many times, and I accept the reality, and I will do it again.
That's nice. So, this could be quite powerful. Now, the last two toolkits. The second last one is seek professional help. See, this is, I think, all of us would believe this. What do you think, guys? If every cancer patient had CBT sessions, no matter what, how severe the diagnosis, even if it is early state, stage, sorry. And even after recovery, if they continue to have CBT sessions, what do you think, it would, what kind of difference it would make to these patients? So personally, if you ask me, I think seeking professional help for cancer patients should be a part of treatment of cancer. So medical treatment, yes, it has its own, uh, impact, and obviously it's the most significant one. But with that, psychological interventions, which will help patients to increase their quality of life, cope with cancer, treatment effects, emotional stress management, problem solving, being assertive, having better communication. So effective psychological therapy in the form of CBT at each and every stage needs to be encouraged for cancer patients, because we know cancer can evoke high level of emotional distress no matter what stage of cancer it is or what type of cancer it is. So we would recommend all of you to spread this word that psychotherapy in the form of cognitive behavior therapy is not just for a mental health condition, or not just for severe cancer diagnosis. It is for anyone, everyone, and make it a point. If you're working in any cancer institute, make it a point to encourage CBT based webinars and tools that would really help our patients to adjust to cancer diagnosis. Yeah, Shrikant sir also said pre and operative CBT sessions, pre-operative, like pre and post. Yes, that is interesting. We could even include these sessions at each and every point with when we are struggling with cancer, right? And I think you had some point, right, Tejas, which you had discussed during our interaction for doctors. I remember your point. So he had a very insightful point. He said that even doctors, nurses, caregivers, other health professionals who are helping patients with cancer, even they should have basic counseling skills and CBT skills. You remember that point, right? So that also needs to be encouraged.
This can be seen as a very collaborative uh, effort. A lot of I remember Tejas saying that it could be really helpful if every doctor could go through some sort of training in counseling or CBT.
Right?
That could be, yeah.
So when you're disclosing diagnosis, that time having a CBT session immediately or in certain gap, then when the before beginning the main treatment, then during chemotherapy, then after chemotherapy, everywhere if we include CBT tools, nothing like it. And then the last tool which we all are going to talk about, and it is, this last tool is personally significant to all of us, and we like to call this philosophical tool, or a tool which helps us elevate our vision. It's a positive psychology based tool, a philosophical tool. The tool is the last point here, which is engage in developing wise mind. So what is this engage in developing wise mind? This is choosing to see the glass half full. That's what this point is. What meaning your adversity has given to you? Yes, cancer is an adversity, but is the experience adding some value? Can we look at it as an experience that is helping us understand some realities of life, that is giving us some value, that is giving us some meaning, some purpose? So this engaging in developing wise mind means finding meaning in your adversity. In positive psychology, we call this benefit finding, the positive effect that results from a traumatic event. Yes, it is a traumatic event, but what did I learn from it? What positive lessons, what meaningful lessons I have understood, or I am deriving from it? This is the most difficult. That's why we kept it at the end. But positive psychology says if you have benefit finding, you'll have good psychological adaptation to adversities. We have seen so many people who have gone through rigorous, most difficult circumstances in life, most disturbing circumstances of life, but this benefit finding helped them to rise beyond the trauma, to rise beyond the limitations of their mind. So I would like to now ask each of our interns to share what meaning your difficult event of life has given you. We could
Should I
start
start?
with, yes, Tejas.
Okay. I believe a wise mind is a common ground between rational mind and emotional mind. So, a lesson I learned is gratitude. Like this during COVID, there were a lot of changes, and I am a kind of a introvert person. So I like to be alone, and but due to the lockdowns, it was too much isolation and too much bad news. So after everything is going down, everything is going to normal, I hope. Now I am grateful for the small stuff, which I was not grateful, and I had heard about this tip for a long time, but now I understand its significance.
And what are you grateful for now?
Grateful that I'm able to meet my friends daily and able to meet them face to face. Yeah.
Right, those little moments. That's wonderful, Tejas. Shruti?
So, one of the things that happened to me about a year ago is that I had a panic attack episode a year ago, and it was very traumatizing for me because I was at a public place at the time. Like I was outside. I was not at my house. So the thought of me being having a panic attack in a very public place was very traumatizing for me. And eventually, as the days passed after the attack that I had, I was reminded by my parents and my other family members as well, ki, you know, remind yourself that you're okay and you are going to be okay no matter what. And even if there is something that happens, you have a huge set of people to have your back no matter what. I think I somewhere read in the corner that your Indian family system, enables this kind of support for a lot of us, like it's like a tribe feeling, that you have someone in your life no matter what happens, and that is something that you need to be reminded quite a lot of the times. So this was something that I really learned. I feel like that could help you to see glass half full.
Very nice. So even during your panic attack episode, the learning was to know that you have people who are with you.
Very much, yes.
Shubhi?
Yes. So a year back, actually, I was doing my first rural social work. So I used to travel to Bihar, and there were COVID time, and it was so panicky. And during the same time, I faced a lot of broken, changed relationship, and it created a toll on me because I was so dependent on people for, for validations or for validating small things or career. And, I never found myself. I never understood what can makes me happy. So, with all the, social changes, career change, and then all the broken relationship, I remember there was a time that for 4 months I became absolutely quiet. I could not process anything. I could not speak anything. And whenever people used to come and ask, "How are you doing?" I used to say, "Okay, fine." Like, nothing is in your control. You can't change people. You can only change yourself. Remember this quote helped me so much that even when I was in a very uncomfortable state, because it was my first exposure to rural India when I went for my social work there. During from that time, next 6 months, I focused so much on myself. I started converting my negative thoughts into positive, like rather than saying that I'm all alone by myself, I used to say I have a lot of people. My work can impact a lot. I always have myself, at least at the end of the day. I actually correlating it with nature. I used to say, "Oh, see, that tree is with me. That element of nature is with me." So, yeah, I engage so much in changing the narrations and changing the self talk that we do with ourselves, especially if our relationship breaks, because it creates a lot of gap and vacuum around us. Now we don't know if we have to talk, if we can find that comfortability with others or not. But yes, I believe it helped me so much open to the world, understand the world is so pretty, and we, in order to have a very healthy relationship with the world, it's very 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 important to have a very healthy relationship with yourself. So yes, I think it helped me a lot understanding myself and exploring what I like. So yeah.
I think these are such heartwarming experiences, and so much. They are rich with values, important values that are going to change us for the better. Now, the experience which I would like to share, in terms of what meaning did I derive from the most difficult event of my life. So this webinar is very personally attached to me. My mother, she got diagnosed with the deadliest cancer, and she is no more. Within 50 days, the cancer just took her away, we could say, because it was the most difficult cancer, and I hadn't even heard about that cancer type when I came to know about it. And during that time, I remember what now when I look back at it, what did I learn? If you ask me, I think we are stronger than we keep telling ourselves. We are stronger than we what keep telling ourselves. The most common way people give up their power, or even I gave up my power, is by thinking that I don't have any power. So one of the first things that this experience taught me was face your fear. My fear was death of a loved one, and I had to face it. There was no other way. So one is that we are stronger than what we believe we are. Second, sometimes head on we have to face the fear. And most important thing that helped me was hold on to God. I think spirituality is the most important coping toolkit for adversities. And according to psychological research, also people who rely on God, or people who use spirituality as a coping mechanism. I'm just saying God, but Shubhi talked about nature. So you could not, so that doesn't mean only God, rely on God. You could rely on nature, rely on guru, rely on family, friends, rely on your vision for life. Hold on to something that doesn't leave you, that doesn't shift you, that never leaves you behind. So my one important coping mechanism was holding on to God and Guru. They are the source of strength, right? And they give us that attitude, you know, to face adversities and to believe that we can be hopeful. Do your best, live one day at a time. So these are some important, coping tools that you could apply. So this is the last point. Engage in developing wise mind, benefit finding even in adversity. It doesn't come during that time, it won't come during that time, but the more you go away from what has happened and the more you see it clearly, you will get some benefit out of it. Just choose to see it. So this is it. I think we are beyond the time that we had thought for this webinar, but we are glad that we all could come together and start discussing, start talking about this such a helpful topic, cognitive behavior toolkit, therapy based toolkit for cancer patients. So can any of you just go through the entire acronym?
Okay, so the acronym STILL I RISE. STILL stands for slow down and be mindful. T stands for turn towards the support system. I stands for indulge in pleasurable and mastery activities. L stands for learning to focus on other aspects of life that aren't affected with cancer. L stands for lift your awareness by understanding what triggers you. I stands for our interpretation and perception largely influence our feelings and behaviors. R stands for recognizing catastrophic thinking and examining it. I stands for increasing resilience through self coping statements. S stands for seeking professional help for psychological distress. And last, E stands for engaging in developing wise mind.
So here's
Very
it. Yes, I hope I'm very, very happy that I could do this with the help of interns, and they came forward to go out of their comfort zone and contribute to this community-based webinar, which is we keep it every month. So I hope your experience was fruitful, Shubhi, Shruti, and Tejas.
I mean, it was definitely. I would like to thank Asira ma'am and Atha for allowing all three of interns for doing this. It was a really amazing experience for all of us also to sit extra and discuss about a lot of things. Like, for example, last night we were up till 12 o'clock talking about all this. So, talking about our own experiences was something which also help us bond with each other. So, thank you so much, ma'am, for giving us this opportunity.
True, I also would love to thank ma'am and Atha. And also it was so great. I was reading comments. It was so acknowledging, and all the practice, all the tensions, all the reading that we went through. We were so nervous. But when we were also going through, personally, I felt so connected to cancer patients because I was reading case studies, researches, to even introduce a toolkit, like even think how this particular tool can help anybody suffering from illness. But yeah, as we are talking more of on a cancer awareness week, I would just love to say that give it a try. At least do little to help yourself and the people around you. Yeah, thank you.
Yeah, this was a very good experience. I was I came to the internship to learn CBT, and the how it affects and improves the lives of cancer patients. Um it showed me how important CBT is, and I like to thank ma'am and Atha for it.
Great, and I couldn't be more proud today what these interns have done. Such an enriching presentation, right? I'm sure that all the audiences, all the viewers here are really appreciating your effort. They find the session to be very enlightening, informative. Thank you all for your kind feedback and encouraging words. We need this encouragement to do more such community mental health programs. So I'm super proud of Tejas, Shubhi, and Shruti for sharing their very best and being their very, very best. So we end with this again, that no matter what adversity, no matter what unfortunate event, whether it's cancer, whether it's emotional disturbance, what we will do? Still, I rise. That's what we are going to do. So thank you once again, and thank you for all the interns.
Thank you. Bye bye. Take
Bye,
care.
everyone.
Thank you.
Bye.